The commute into Canada's biggest city is about to get more complicated.
It's frustrating. There's no question. I'm not hiding my emotions. I'm frustrated, but so is everybody else.
As many as a third of workers who make the GO trains go are out sick or isolating. Starting Monday, the schedule will change, cut back 15%.
We want to spread out the pain so no one customer is impacted the most.
There are so many impacts from Omicron sick calls, and they're all adding up. In Victoria, police officers who normally work office jobs may need to be redeployed to the front line. The Vancouver Fire Department is seeing high levels of absences. Earlier this week, Prince Rupert's fire department had to warn neighboring towns it might need help.
It becomes concerning in a different way, of course, when we're dealing with public safety. That it's a lot different than losing a flight because the aircraft don't have enough crew.
Food producers are worried too. One big concern, what happens if railway workers get sick?
It's typically a time, this time of year where a lot of our grain does get shipped. So just on our own particular department, that could be an issue.
Delays in processing foreign worker permits could also hurt agriculture.
If you're a greenhouse operator and it's planting time and you don't have enough workers in place, it's very stressful.
These are all new stresses on already stressed supply chains, on schedules, on patients. Even industries that practice disaster scenarios don't have a blueprint for this.
Those are typically, in our planning, are short-term events. Those are not 2 years events.
The situation is changing fast, so presumably shortages could improve as quickly as they developed. In the meantime,
well, let's keep our fingers crossed and hopefully things start getting a little bit better.
Lindsay Duncombe, CBC News, Vancouver.
Well, let's hear more about how Omicron is having an impact on 3 very different workplaces. Joining us, Cara Pilak is the Executive Director at Oak Park Cooperative Children's Centre in London, Ontario. She's also the chair of the Licensed Childcare Network's Advocacy Subcommittee. Peter Joseph is a paramedic in Lyndhurst, Ontario, that's east of Kingston, and the Ontario Ambulance Committee Chair for the Canadian Union of Public Employees. And Micheline Saint-Hilaire is the CEO of Action Marguerite in Winnipeg. It operates several long-term care facilities. And welcome to all 3 of you.
Thank you. Thanks so much, Ian.
And Cara, let's start with you. Tell us about the challenges you're seeing at your childcare centre.
Yes, thank you, Ian. The childcare sector has been met with many challenges throughout the COVID pandemic, and specifically during this Omicron variant. We've recently been dealt with the decision that testing will stop in childcare while we continue to operate. So our staff and children can no longer be tested. So that's becoming challenging for us regarding staff illness. So we're having to assume staff and children have COVID and send them home for 5 days. Additionally, our staff are burnt out. They've been working throughout this COVID pandemic. And as some may know, the childcare sector has notoriously low pay. So our sectors, there's multiple issues that are having our sector being burnt out.
Mm-hmm. And Peter, from a paramedic's perspective, let's focus first of all on whatever you've seen that's changed, particularly with the growth of Omicron. What's it been like in the last few weeks?
So the last few weeks, Ian, it's been a challenge. We're seeing an increase certainly in the amount of positive cases that we're responding to. And we're dealing with a lot of staff shortages in the system right now. It's challenging, and Omicron is certainly it's bringing some challenges to the EMS sector, but we're sticking in there and we're digging deep, and we're doing the best that we can.
And have you been out working during this? I mean, does it feel like we all know how transmissible Omicron is? Does it feel a little daunting for you?
It's extremely overwhelming. I personally am seeing an increase in the amount of positive patients that we're picking up on a daily basis. It's taken a mental toll this last 2 years. We're tired. We're constantly being asked to work overtime. And we're taking the overtime because we don't want to see ambulances downstaffed. So we're working hard. We're digging deep. But it's not without mental strain to our paramedics in the province.
Micheline, what about what you're seeing in terms of long-term care?
Yeah, so here at Action Marguerite, we have 3 personal care homes. All 3 are currently in outbreak status, which essentially means that now our residents, as well as our staff, have been infected with Omicron. The cases continue to rise, which means that this really puts us into staffing challenges and, dare I say, crisis. We're managing to bring staff in and have them present. We manage this almost like it's day by day, but at times it's moment by moment. And we're piecing it together. We're counting on our staff who, continue to step up and show up. They're picking up extra shifts. They're working overtime. We're also hiring agency nurses. We're redeploying our staff from other departments to assist where the needs are greatest. People are calling us to say, where I'm a healthcare provider, I'm available, I'm retired now, and I can come and offer my services. But what we know is that this is not sustainable.
Cara, I know there are big issues here, and I know you talk to other childcare centres around the province, but on a personal level, what impact have shortages and just Omicron had on you?
It's been a challenging week for the childcare sector. We've had a lot of recent changes. Like I was saying, the testing has been taken away, but I've had families withdraw their children from the center, and that leaves us with a shortage of funding in an already underfunded industry. If I can echo the other speaker's comment, the childcare sector is also across Ontario short-staffed. We have a shortage of qualified early childhood educators due to the working conditions and the low wages. So we continue to have the same challenges as my fellow colleagues do as well. And
Peter, in a lot of workplaces, people are wondering about, who's going to be sick next or potentially exposed to Omicron and maybe can't come in. What about in your ranks among the paramedics? Are you seeing a lot of absences?
I think we're starting to see an increase in the absences. I think more paramedics throughout the province are being tested positive. But again, it boils down to, we're severely short-staffed, and we always have been. It's a systemic issue that has faced EMS for decades. So yeah, it has an impact certainly on us.
Micheline, maybe we can end on a somewhat positive note. I think you touched on it before, but you are seeing people kind of step up to help.
Yes, they are. As I mentioned previously, the staff are rising to the occasion. People are volunteering their time. But that being said, it's sure it's a positive note, but we know we're well surrounded. Yet the impacts of this staffing shortage are really being felt, and that weighs heavy on a leader's shoulders because we aren't always able to meet the needs of the people that we support in the ways that we know and that we know how to do. And right now, we're not always able to meet the needs in those ways, and so we really need to strengthen our system both during a pandemic and even outside if we're going to make it through this wave and beyond.
All right. Well, it's going to be, we know, very challenging few weeks ahead of us. Thanks to all three of you.
Thank
you.